any.
Hi there, everyone. Welcome to BioXcellerator's Instagram Live. Okay, let's be real. My name is Jennifer Waldrop. I'm the director of the Healthcare Practitioner Program here at BioXcellerator, and I have Tim Thompson today with us. He's a physician assistant with a sports medicine and orthopedic background for over 20 years. He's also a leader here at BioXcellerator. Today, we have our special guest, Dustin Bunch, with us. He is a former Southern California firefighter that dedicated 11 years of his life to his community. He has an expertise in highline power and safety rescue for Bernard Construction. But that's not what makes this interview so special. What makes it so special is that he's a leading advocate for spinal cord patients. Today, we're going to discuss his injury, his recovery, and his treatment here at BioXcellerator. Hi, Dustin. So good to have you with us.
Hi.
Hi. Can you share with our audience a little bit about your injury and what's got us here today?
Sure. 4.5 years ago, we were out in Parker, Arizona, just south of Havasu, and jumped off the boat, and the water was like 2.5, 3 feet deep. At that time, I was 6'6", 270 pounds, just corn-fed meathead. When I dove in, I broke my C5, C6, made me a complete quadriplegic basically instantly. Nobody wanted to do surgery. We had to go through that whole spiel first to get the surgeries done and experimental and all that kind of stuff. After the surgery, there was a slew of my family and friends and firefighter friends and people within the IBW all in the waiting room and trying to figure out the best possible way and what was going to be the quickest, best recovery for us. And I'd been following Matt Hughes's recovery for a long time since he got hit by the train. And when I woke up from my surgery, I told my wife, like right away, once they told me what happened to me and what was going to, my life was going to entail, I told her, got to find out what's going on with the stem cells. And that's what got me in touch with BioXcellerator. A few days later, staff at BioXcellerator actually came over to the hospital, discussed options, and then we made a plan. And 8 weeks after the surgery, I jumped on a plane with my wife and another firefighter buddy and headed down to Medellin. At that time, I had no control, no movement at all. I mean, the top of my body was strapped, the bottom of my body was strapped to the chair. Couldn't control anything. Before the first surgery, I was on 13 pills twice a day before getting down there and taking the first treatment of stem cells. And now today, I don't have any medications, no straps, and just moving around every day and keep fighting.
I love it. Well, I am inspired by your story, and I am curious, how did you learn about Matt Hughes? Was that just through Instagram, or how did you learn about stem cells in general?
I think what's important here.
So when stem cells first started coming out, I was working with. Can you guys hear me?
I think there's a delay. Now I can hear you. I think there's some technical difficulties. Let's see.
So when we talk about getting stem cell therapy, and Dustin can comment once he comes back on. There you are, Dustin. Can you hear us now?
Yeah, I got you.
Okay, perfect. Go ahead, Tim.
So Dustin, talk to us about that initial time period between injury to surgery to stem cell therapy. Talk to us about what was going on in your mindset. Was there a period where it was negative? How quickly did that turn into, okay, what do I have to do? And talk to us about your support system as you were going through that process.
So in the initial stage, obviously when decided we were going to go with stem cells, we presented it to the doctors and the surgery team, and they're against it. Western medicine wasn't going to allow any type of stem cells or anything like that to be part of their recovery process. So we had to do all that on our own, and then working with the doctors down in Medellin, Dr. Helper and the team, to figure out the best possible way first to get down there, knowing that we couldn't leave until 8 weeks, insurance reasons and whatnot. But finding, obviously there was a lot of places that are doing stem cells and making that decision on where to go. And Medellin's, a lot farther than some of the places. But when we reached out to the team at BioXcellerator, and they came over to the hospital, went over everything with us and all the results, got Dr. Helper on the phone, and then realized that, that it was going to be a team effort and not just go get a treatment and go home. So on that side, that was like our deciding factor that, everybody was welcoming from BioXcellerator. On the other side of just being able to find out about stem cells, that was just a lot of my own doing before the injury and stuff, being educated on what was coming up in the medical fields. And I was working with the IBW and Barnard Construction, building power lines. So a lot of those guys, they go through a lot of long hours, hell on their body. And I'm always like trying to get them to, spend that extra money for, themselves to keep their body going and stuff like that. So I had a little bit of knowledge on it before me getting into myself.
And talk to us about your first visit, your initial impressions, and then how that subsequently changed or stayed the same as you went through your treatment process.
Okay. Yeah, the first treatment down there, like I said, we went down in 8 weeks. And just getting down there was a feat itself in that side. But after the first treatment, Dr. Helper asked if we would, be able to stop all the medication, the gabapentin and all the nerve pain medication that we were on top of the painkillers and blood pressure pills and everything, just cold turkey. And it was a lot because after I had my initial surgery, the second day, I asked my wife if they could stop all the pain meds when I was still in the ICU because I wanted to feel how bad the pain was and if I could take it. After about the 4th day, I got back on the pain pills because for the pain medication, it was just too much at that early. So I was a little hesitant to do it, but we went ahead and did it. And then after basically the 3rd day being down in Colombia and getting the treatments and stuff, my nerve pain started to go away. Now, today, I still have nerve pain, but not enough. I haven't taken any pills for 4 years. I haven't taken any gabapentin, anything to do with like neuro pain per se. I don't take blood pressure pills. Everything's regulated still to this day. So that part's really good. The deciding factor, I guess, once I went down the first time, we knew that we were going to be on a 3-month rotation, and every 3 months go down there for a new treatment intrathecally and stuff. But then we ran into COVID like the rest of the world did. So we had to extend being able to get down and travel and find different ways to get down there. But since then, I mean, I still get treatments and I still don't have pain. Spasticity wise, I don't have a lot of spasms. On that side of just randomly shaking, obviously when I lay for hours on end or lay in one position, spasms will happen, but nothing compared to what a lot of people have to deal with. And pain wise, I do have it in the upper body. It's there, but not nearly as much from some of the stories that I hear from other patients.
So you're an advocate for stem cell therapy. You speak to a lot of the patients that come to BioXcellerator that have spinal cord injuries. What are some of the common things that they ask you besides the nerve pain, whether it be about treatment, whether it be about your recovery, timeline expectations, those types of things? What are some of those common things that those patients are worried about or curious about?
A lot of questions that happen on a weekly basis when people call and they want to talk and discuss is how the recovery goes. How fast is it? How fast do we get to start feeling that the stem cells are working? And a lot of it is based a lot on diet, making sure to stay on point on that side for me. But as far as the stem cells reacting with the body and me being able to feel it after the first time, it was within the first couple weeks there, I noticed the nerve pain going away. Now, as far as recovery wise, I have upper body mobility. When I first started, I wasn't able to raise my arm above my head at all. And now both sides, I'm able to do that. Moving around, I can get around all 4 acres of my property, plus and minus a gopher hole here and there. But as far as opening doors and stuff like that, getting movement back is what a lot of people want to know, and how fast that happens. And every patient's going to be different. But it's like I tell everyone, it's the work that stem cells need to know what need to get fixed, and they'll find it. But it's also the amount of work that you're going to put into the places where you want the most recovery.
Yeah.
Patients want to know a lot is how to fix the nerve pain. And for me, like that was number one, like it, feeling like wasps are biting you and you're constantly getting bit, and the being uncomfortable part, I think is always going to be there for people in wheelchairs, but it's finding a happy medium to live with. And I know that the stem cells have worked for me.
I think that's one of the reasons why we did this today is the title of it of, okay, let's be real in regards to the expectations in treatment. One of the questions that came in from someone on Instagram Live is why, maybe Tim, you can speak to it, and then Dustin, you can tell us your experience, but why do people need more than one visit for stem cells?
So really good question. And again, we do have the live chat feature, so please ask your questions. That's what we're here for. So you have all those questions, or as many as possible, answered during this session from somebody who's lived it. So at BioXcellerator, everything that we do is based on scientific evidence, whether it's a spinal cord injury or one of the other many orthopedic or autoimmune diseases that we treat. Everything is based off science. And what our research and epidemiology team has done is collect all that science and put together a treatment protocol for spinal cord injury patients. And it's a multi-visit treatment protocol. And the reason being is there's a couple of studies out there that showed that after, say, 3 or 4 treatments, patients were having certain effects, and those effects were good. Those same researchers also found that once they started decreasing the number of treatments, the number of cells that patients were getting over a certain period of time, that those positive effects that people were seeing started to go away. So again, our research and epidemiology team said, okay, this is the research out there, not done by BioXcellerator, but other thought leaders in regenerative medicine and stem cell therapy, that said multiple treatments are more effective than a singular intrathecal treatment. So that's why our protocol is a multi-visit protocol.
Dustin, do you have anything to add to that as far as not necessarily our protocols, but what your experience has been with your visits?
So I definitely noticed in the beginning, like I said, we did things, and it just happened to be like when I got injured, we got hit with COVID. So don't break your neck or anything or your back during COVID. It's not good. When you spread the visits out, it was definitely, you could feel more of the nerve pain coming back. But at the same time, like the body recovery wise, like my therapy sessions and my PT sessions were 5 to 6 hours a day. So recovery wise, once I get stem cells, like it's kind of like I don't have to wait on recovery at all. I can work out every day and not have that muscle fatigue and stuff like that. But then when the stem cells in between treatments are spread out farther, it's definitely you can notice a difference.
Speaking about that, I know you and I have discussed quite a bit about your physical therapy, your mindset coupled with stem cells. So it's not just a one stop, but it's the effort you put in. Can you talk to our audience a little bit about your mindset and what you have experience as far as like your work that you put in, exercise, physical therapy?
Right. Well, I mean, when I broke my neck, it was more or less a team effort. I'm married to a badass woman, and we made a decision that we were going to go at this together. So, I mean, when she's waking up at 4:30 and we have a 10-month-old and dealing with that, I have no reason to not give 110% every day. So, for the first year and a half of recovery for me, we'd leave the house at 6:30 and drive Southern California traffic. Anybody that lives here or been here knows. You drive 2.5 hours and you went 20 of therapy in one place to drive another 2.5 hours to do more therapy there. And it wasn't just the physical side of it, because that first year and a half was a lot of learning how to remove again and learning how to adjust and work with what you got. Like, I don't have full hand functions. I got more of a whack-a-mole hand. So learning what to use and how to use with what you have in your recovery is key. But also putting in the work, making the body learn how to move again is best. And I started directly in the hospital. We were in the ICU, and I had friends and family that would just be on rotation every 3 hours. We're going to move every body part, move every muscle we can, just to try to get the nervous system talking again. And that's key, I think, in the beginning, is once you start realizing that you have to start over again and you accept it, is the better off you're going to be. Accept reality, move forward, try not to go down that hole of, the poor me or why this happened to me. Because, I mean, it will, it'll take over your life if you allow the depression side. But, not every day is going to be a great day. I understand that. I mean, there's shitty days and literally shitty days. But after you get over that, like, let's get back to work is the mindset you need to have.
Dustin, talk about that just a little bit as far as your support group. You talk about the firefighter brothers, you talk about IBEW, you talk about these different circles that you have. How have they impacted your mindset? And alternatively, or as well, how have you affected their mindset? What have you done for them? Because this has got to be push and pull, right? It can't always be a one-way street.
100%. It was definitely life-changing for a lot of people, and a lot of my friends, circled around us, and they've always been there. But a lot of people, it's hard for them to deal with just seeing me in a chair, because I was the guy, like with the IBEW, when the mine guys get hurt or the construction guys are getting hurt, they're calling me and trying to figure out ways for them to recover and get back to work as fast as possible. And I was more or less that PT or that doctor for them, to get them back to work and get them a paycheck. The firefighter world, I mean, we've been through so much together in that group that, you're living in a firehouse together 7 days a week. Sometimes, for months on end, you don't get to take days off because SoCal burns, California burns, everybody knows it. And those guys, they're always there. Like my wife, she works full time. We own a company together, and she also works for another company. So she's got to travel. And then when she travels for those times, guys would have to come over and step in. And that doesn't mean just, watching somebody in a wheelchair. Like, there's a bowel and bladder care program that has to happen, and that is a lot of times, a lot of people can't deal with that. But I've been lucky enough to have a good brotherhood of people that step in, and sisters that, you're going to have to give a finger or two, literally. But for me, I mean, I've been definitely blessed. Nobody's really walked away. Everybody's always kind of been there in full force because, like I said, my daughter was 10 months old when it happened. Sherry works full time, and we need help. I don't get to be that guy that lifts up the railroad tie and throws it on my shoulder and goes and puts it in the backyard because we got to stop a flood. So I'm able to call people, and they come, and they're always there. Um, I've been definitely blessed on that side. And a lot of it has to deal with just being open. Um, a lot of people always say that, I feel like I'm a burden to everybody because I'm in a wheelchair. Like, yes, I can see where that comes from. And I've taken that route some days where it's like, I just won't ask nobody to help me and I'm good. But then at the other end, it's like people are more than willing to help as long as you're being open. And you got to realize, as a person in a wheelchair, I have a caretaker that works with me every day. In the beginning, Jason was just a friend and a brother, and then he knew no medical knowledge, and absolutely hates bowel care, but stepped up and was there every day for the family and stuff like that. And still to this day, it's being able to explain to people what you need and what can help, and then also understanding it. If you're in the person in the wheelchair, the person that's the caretaker taking care of you, they need a break too. Like they're with you 24/7, and just like my wife, like she, hey, go have a weekend. And I wish she could have more of those, especially now because she's pregnant again.
Well,
But
congratulations.
understanding both sides of that, when you're in the wheelchair and the person helping the wheelchair, it's open and honest communication, and you got to be just brutally truthful.
Right, and that leads to another question came in, and again, keep asking your questions, because again, the more information you have, the better your outcome is going to be. Question came in about how many times do I have to visit, and how far are they spaced apart. So our protocols are developed, again, multi-visit protocol. They're 3 months apart, and that's again what the science says. But keep in mind that during those visits, like Dustin just mentioned, there's a mandatory companion. There's got to be somebody with you. You've got to have some kind of support system to help you through the travel and the meals when you're not at your home that may be designed for your abilities. That when you go on the road, it's a little bit different. But we have also made accommodations for wheelchair
And I can attest to that side. Um, just going down there in the beginning, before, has changed so much from traveling today.
I think one of the other questions that came in that I think we should speak to, Tim, is can you talk to us a little bit about why why the use of stem cells isn't allowed here in the United States or not FDA approved?
Yeah. So again, the BioXcellerator cells that we use are allograft from donors, umbilical cord, and we can have a whole discussion about sourcing stem cells. But in the United States, you're limited to bone marrow stem cells. You're limited to maybe adipose-derived stem cells, at least that are cleared by the FDA. The umbilical cord stem cells are not cleared by the FDA for use in the United States for these, and there's different reasons for that. They're doing their research, but I think it will continue to take some time before we see them make any movement on that. So there's things that we can do down in our clinic, in our cell bank that's connected to our clinic in Columbia, as far as cell expansion, which allows us to treat many more patients than we would be able to using just regular stem cells that are available here in the United States. So again, it's an FDA clearance thing that I don't know what their timeline may be. But for now, we're doing things again with umbilical cord stem cells, not embryonic cells. That's a completely different type of cell. But umbilical cord cells is what we use, particularly the Wharton's jelly from the umbilical cords.
One of the things that Dustin brought up was about bowel and bladder function. And a question came in from our audience, and it was talking about how do stem cells assist with bowel and bladder function in particular?
So when we think about levels of injury. And again, Dustin's was pretty high, and they can be at the cervical or neck area. They can be in thoracic or mid-back area or the lumbar area. So depending on what level of the spinal cord is affected, depends on what kind of function you have. And that could be your heart and your lungs and your chest. It could be your bowel and bladder and your abdomen. So depending on what level is affected, depends on what kind of function or non-function that you have. Now, what we typically see, both from the research and from our patients that have come through BioXcellerator, is that certain patients with certain injuries will have improvements in bowel and bladder function, and that's reported. And we can ask Dustin what his experience has been. But that bowel or that bladder function will be tested during your visits at BioXcellerator, so we can keep track to see if there is any increasing in function with the bladder after stem cell treatment. And we have found that to be true, and the data and the scientific data and evidence will attest to that as well. Dustin, can you talk to us a little bit about your experience with that?
Of course, like I mean, in the beginning, you anybody that's gone through a spinal cord injury, I'm sure, has gone through it, but there wasn't much function at all. And I still, to this day, I intermittent cath. For me, after getting the stem cells, I did a double whammy, and I also treated it with neural acupuncture, actually in my bladder. But for the most part, I mean, going off road, and I spent a lot of my time in our 4 acres is nothing but dirt, and the shaking of the body and going down bumpy roads and everything like that, they used to set me off, and I would literally leak all day long. But today it's very, very minimal. And I think a lot of it was just being able to let it come back, but at the same time with the stem cells, once you're working at it, you're constantly squeezing the bladder, making sure that you're trying to regain that function. And the same thing goes for bowel. Like they'll teach you, in your recovery in the hospital, like they'll actually go, hopefully they do, wherever you get your surgery and, on that side of it, but you're actually squeezing the muscles, trying to get them to open and close and interact again. And a lot of it, is going to go back to the same way that a bodybuilder looks at building muscle. You got to think about the mind connecting to that muscle and be in connection when you're working at those things. You just can't go through a motion of if you're doing a bicep curl and you're just going onesie twosies, like you're never going to get growth at all unless you're trying to do the mind to muscle connection.
Right. And that's a good point. You talk about the work, you talk about building off a foundation. Everybody knows what to do in order to build muscle, and this is no different. It takes a lot longer, and it's a lot harder. It's more strenuous, and you need help. But again, bowel bladder function is muscular, and just like every other muscle in your body, it's got to get trained. So that's part of the work that you've got to put in.
Yeah, in the beginning, I couldn't feel anything, and I say the beginning, like from the first treatment I got at BioXcellerator, there was no feeling at all in the bowels. But today, like I definitely have the feeling and knowing open, closed, or what's going on.
It seems like your dog knows that as well, so that's good.
Yeah. Grant's always on it. No, out.
Hey, Tim, a question came in, and maybe we could talk a little bit about this. Can you talk to us about exosome versus cells?
Yeah. So again, a lot of what we hear in regenerative medicine, at least here in the United States at this point, is exosomes. Everybody wants exosomes. If you take a step back to look to see what they do, exosomes are actually secreted by stem cells. So there's differences in how quickly they act and how long they act. We do not give isolated exosomes at BioXcellerator. All of our treatments are based on umbilical cord, Morton's jelly umbilical cord stem cells. Our thought process is there's a lot other things that the cells can do besides just the exosomes. So at this point, our treatment therapies are, whether it be for spinal cord injuries or anything else that we treat, again, the orthopedic injuries, the autoimmune diseases, everything that we do is based off orange jelly umbilical cord stem cells.
Another question came in, Tim, about ozone therapy, and is that recommended, or what supportive therapies, do we recommend for stem cells and help regenerating stem cells, or how does that couple with the therapies that we provide here at BioXcellerator?
So there's a lot of things that we do, and Dustin can attest to this as well, that whether it's spinal cord, whether it's all these other things that are treatable with stem cells, making sure your body has the correct environment for the optimal function of these stem cells is really important. And Dustin mentioned it at the very beginning. We're going to get back to it here in a second, talking about diet. So everybody gets a nutrition consult. Everybody looks at supplementations to make sure gut health is optimized. Our clinic can also provide complementary therapies to get the rest of the body designed in an anti-inflammatory state so that the stem cells can work their best. And we're talking hyperbaric chamber if possible. We're talking ozone therapy if possible and not contraindicated. We're talking cryotherapy. We're talking vitamin drips. All these things that are going to help the body get into the optimal environment for that. But Dustin, let's talk about, you mentioned it very early on. I want to get back to it, about diet. And just like you're putting in the work for everything else, talk to us about how your nutrition stayed the same if you were providing this environment beforehand, or if you changed something after your injury.
No, 100%. I mean, like I said, I was large, and I was a meathead, typical. Just go in the gym, blast weights, run every now and then, and jump rope, in between sets, because my schedule was always work, work, work. Once I got hurt, and learning about low inflammation diet and how it works, and it's definitely a change of everything when you take caffeine away and alcohol away. Go on low inflammation, and I am by far not a advocate for vegan at all, because I love red meat and I love going hunting and eating elk and bison and everything else I can kill. But the biggest thing is moderation and learning how your body's going to deal with it. Before stem cells, going to get treatment and stuff like that, making sure everything's super clean in your diet. A lot of greens, a lot of fruits, nuts, just trying to make sure that you don't have, like you said, that nasty gut health. If your body is full of red meat and full of potatoes and everything like that, trying to digest, you can tell you feel sluggish, like after Thanksgiving Day. But going on low inflammation and eating a lot of the fruits and the greens and making sure you're still getting plenty of protein to build your muscle, it is a change. And I usually start, a month or two before I go down, and get treatment, and then I stay that way for 2 to 3 months after treatment, just to make sure the stem cells are getting where they need to get, working and trying to heal what they can. But even, on a regular nutrition for me, I have to stay low inflammation for the simple fact of the Bowel program.
Right. And Dustin, I want to pull that thread a little bit more. You talked about planning before you go down. And with that, I want to throw in goal setting, right? Because we know if you don't write things down, that they're just dreams in your head. Talk to us about anything that you do on a daily basis, on a weekly, monthly basis, whatever it may be, to set those goals and to set those plans in place. This way, it's not a surprise, or it's not done randomly. Like, talk to us about what you do as far as pre-treatment and post-treatment to make sure you're prepared.
Right. For me, in the beginning, it was basically, trying to say, okay, I'm going to walk again. It's just wasn't in my cards at that time. Like, I knew from my medical background and looking at, the x-rays and after the surgery, it was going to be baby steps. Learning about the diet side was new for me. So trying to sit there and say, hey, you're not going to have a steak 3 times a week was, disheartening. And, we shed a tear for that. And no Jack Daniels on a regular basis is another thing that we had to come to terms with, But as far as setting my goals for getting things to work back to, and that was working with my PTs and saying, okay, like, my biggest part for me was making sure I could have upper body. That when I first got injured, I wasn't able to hold Araya at all anymore. Like, we had to train her basically to climb up my legs every night to give me a hug because I couldn't bend over and pick her up. I didn't have that control to do that. So making the goals of, okay, if you're going to be able to sit up, like how much are you going to have to sit up? And it would thousands and thousands of sit-ups. And at first, when it first started, they would untie my chest and it was like, okay, like just start with a little bit. But each treatment after I went down, I made bigger and bigger goals. Being able to raise hands above head, being able to hold my own cup, being able to take my shirt off, put it back on. Those are all things that we would write down and put it in the garage to make sure that, okay, if you're going to set that goal, let's work towards that specific goal and don't get away from it. And like I tell people that I talk to and mentor, and if you're sitting in the hospital right now and all you can move is your shoulders, well, how many shrugs can you do today? And a lot of the guys and girls will tell me, oh, I can do them all day long. All right, well, let's do them. And for the people that are looking and they want to have phone calls, I don't have a phone call, it's a FaceTime. I want to actually see your face and I want to make sure you're moving and putting in that work, and most, they'll be at 200. Okay, well, tomorrow when I call you, we're going to do 250. And making sure that you keep that goal set when you get out of the hospital, because there's no sense in going down and putting the money in to in the time to get stem cells if you're not going to put them to work.
So we see that for all of our patients. And again, the programs that are designed for our patients are holistic. It's not a magic shot. Stem cells aren't going to cure everything. If you're not putting in the work, changing your lifestyle, exercising, do everything you're advised to do to keep this going, whether that's, again, orthopedic injuries, whether it's somebody on the live chat mentioned fibromyalgia or nerve injuries or whatever else it may be, these things that we treat, it's not come down, get a couple shots and be done. These are things that you have to continue to make sure your body stays balanced and the stem cells can work as good as they can throughout your life. These are lifestyle modifications. They're not just, I'm going to do this for a month or two and then we'll see what happens. You're just going to go back to where you started. Some other questions did come in regarding some of our other treatments. At the end of this live event, we'll have a link that will give you some contact information to allow you to get on our patient advocate schedule. So make sure you click on that at the very end if you have further questions about treatments other than what we're talking about here in spinal cord injuries. Again, before we end this in probably the next 15 minutes or so, I did want to get to some of the other questions that we're asking about viral reactivation. I'm not quite sure where that came from, but active infection is a contraindication to getting stem cell therapy. But again, we can follow up with that after if we need to. Another question came in, a popular question about graft versus host disease. Now, again, the stem cells that we use, the Wharton's jelly umbilical cord stem cells, for lack of a better medical term, and for our audience, these cells that we use don't have antigenic markers that the body recognizes as foreign material. So when we talk about other kind of organ transplants and making sure that your compatible matches, these cells don't have those what's called HLA tails that tell the body that they're foreign, they need to be attacked, and they go away. So there's low risk, if not risk at all, for graft versus host disease or rejection by the body. So I just want to make sure we clarified that up before we went any further.
Yep. Go ahead.
Go ahead, Jennifer.
One of the questions going back to Dustin, and the reason why we did the okay, let's be real, I was kind of curious, and we had talked about this offline, about what are the common questions you get from spinal cord injury patients? Because I know that you like to do FaceTimes one-on-one with these injured patients, but you yourself, like, what is the common question that you get all the time on your feed and your Instagram and WhatsApp?
Are you walking yet?
Is that a goal? 100%.
Yeah. No, a lot of times it's the number one thing is people deal with pain. And that's the difference. There's a lot of different, there's complete and there's incomplete when it comes to a spinal cord injury. And every spinal cord injury is different. There's people that have the same injury that I do, same break, and they have more hand function. But that's just how that nervous system works. Their biggest question all the time is the pain. Is BioXcellerator, working on fixing nerve pain, or can the stem cells make my nerve pain go away? And like I've told people, for me, it's a game changer. Um, I travel all over the place. I mean, I get to travel to Medellin. I like to go back home to Montana. Love going hunting. Like nothing is, it hasn't stopped us as a family from traveling and camping and all that kind of stuff like that, because of what I've been able to accomplish in my recovery, with the stem cells. I don't have to, like I said, take pills. I don't sit in the corner in pain. And for me, telling the people on the phone, and when I do FaceTime them, it's helped me, and I think it can help other people. I've seen it help other people. You just have to go and put in the work and get it done.
Dustin, you're making this sound rosy, for lack of a better word. But there's got to be times where things aren't so great. How do you work through those things, and talk to our audience about what things that you do to get past those valleys so you swing back up?
Right. And like I said, I'm blessed. I have a hell of a circle. The boys that have always been with me, and the girls that I worked with, and my family, I've been blessed. But there are those days. I mentioned the other day my Instagram, telling the story, laying in bed and wake up in the middle of the night. My wife thinks that the dog shit all over the floor, and it was me. Those are days. It does suck. But accepting reality is one of the hardest things when you live in a wheelchair. It's not the life. I was 36 years old when I had my accident, and I lived a great life, got to do amazing things, and I still do. It's just having that ability to know that you can push through it. If you're gonna sit in the past and not move forward, then you're not going to get anything you want out of life. And that's not who I am. I'm going to push every day. I mean, my daughter comes home from school, and the first thing she wants to do is play tag. Well, when we got our new house, I had to put concrete in all the way around the house because there wasn't there, and it was only dirt. It's like, well, I can't go that way, and I'd get stuck in a gopher hole, and my wife would have to go get her go-kart and pull me out with a ratchet strap. There's gonna be bad days, and accepting them is the hardest part. But once you accept it and move on and get a sense of humor about it, life is so much better.
Yeah, it's and we know from a lot of the literature that's out there that mindset has a lot to do with this in recovery, whether it's post-injury, whether it's post-surgical intervention, whatever it may be. Talk to us about what surprised you the most. What was kind of like, well, I didn't expect that, but that happened. Just to give our viewers some insight.
For me, it was accepting it. Like, I didn't bounce back. Like I said, I've always been a meathead. I've always pushed through and done everything, pretty much by myself, and I'll get through it, and I'll use pure strength. And if I don't have the strength, then I'll get more strength. So after my accident, and the first 6 months, it was like, wait a second, how come I can't push through? And then after that first year, I had a manual wheelchair built. Being 6'6", you can't just go to a wheelchair store and say, hey, I'll take that blue one. You gotta save money and build everything yourself. And when I got the manual wheelchair, I figured I was going to own it. Like, well, I got plenty of upper body strength, and like, I'm going to push through and be fine. Well, I rolled down the sidewalk, and the very first crack I couldn't even get over. Not having tricep muscles, that are strong enough to push myself through, the reality, would sink in a lot of times. And it's like, well, I'm stuck. Even in my electric chair now, people ask, why aren't you using a manual chair all the time? Well, I live on 4 acres, and 3 acres is nothing but dirt. So having off-road chairs in a manual chair would work, but it would also, everybody be waiting on me. And I do use the manual chair when feasible and when traveling. But for me, the hardest part was not being able to just push through it with pure strength and get my recovery. And that was a little disheartening, and had to deal with. And just basically look at yourself in the mirror and say you got to keep pushing through. You'll get there.
I love that. Dustin, when we talk about your experience at BioXcellerator and how you came to us post treatment, what has your experience been with BioXcellerator after your treatment?
As far as recovery,
As far as recovery, our staff, etc.
well, Bio's family. Like I said, I've been now going for 4 years, be 5 years this next year of treatments, and making lifelong friendships. At any time, I can call down and say, "Hey, this is going on. Is this something that you guys are used to seeing?" There at the beginning, and now it's I enjoy being able to help new patients, talking to the patients when they're in the hospital, letting them see that there is other means besides Western medicine, and Bio can help. And it's not just the stem cells that Bio helps with. It's being able to send home the diet plans, being able to sit there and show somebody that this is the way you're supposed to stretch, versus what you see every day on YouTube or something like that.
Yeah.
On that side, you don't get the at other places, or you're definitely not getting out of a doctor's office here in the States.
Got you.
Right. And Dustin, it's such good insight. And there's questions that have come through the live chat as well. It's like, well, how do I know if this can help me? And that's probably a little bit too deep for this conversation. Just know that it's definitely going to be patient dependent. It's going to be injury dependent. We know that the cells that we're using, the Wharton-Jelly umbilical cord stem cells, are more effective than, say, bone marrow adipose stem cells for multiple reasons, whether it's harvesting, whether it's potency, whether it's cell count, and those types of things. So just know that a lot of that's going to depend on the injury that you have, whether it's spinal cord or something else, that every patient's going to be different. What we do offer for our patients or prospective patients and people that are curious is on our website, bioaccelerator.com, under treatments or spinal cord injury. We do have the outcomes of our patients that have gone through treatment, and it's based on whether it's cervical, thoracic, or lumbar. You can see the patient age ranges. Male is way more dominant than female with the number of patients that we see. But all that data on how patients are doing and how it affects their ASIA score, their functioning score after, is available on our website. So again, patients or potential patients can see what has happened with our patients and how they've improved over as far as their function. The reason we have that data is because of the clinical care program. Now, this is a program that for spinal cord patients, it's going to follow you for 2 years. Every 3, 6, 9, 12, 18, 24 months, our medical doctors and our research team are actually going to go through questionnaires with you to see how you're doing, to make sure that you're getting the most effect out of your treatment as possible. And again, that's the diet, that's the supplements, that's the physical therapy. And there are some great clinics out there that we work with because nobody can actually go down to Columbia for the physical therapy that you need, but we can certainly put you in contact with some of those clinics that we know around the country, at least in the US, that are performing physical therapy specific for spinal cord injury patients. So we just want to get that out there again, that everybody's different. We know the cells work, and that's based off of the scientific evidence that's out in the literature, as well as our own patient-reported outcomes that we collect through that clinical care program.
Absolutely. Dustin, at the close of this, and I'm just wondering how you, like, if there's a spinal cord injury patient out there that's wanting to connect with you, how do they reach you? What would you prefer?
Direct messages through Instagram. Is fine with me. I mean, I usually try to give each family or patient like 40 minutes. 3 a week is usually what I'm doing right now. But as far as anything with question wise, I'll go through like what I've gone through. As far as the medical side and stuff like that would be directed towards Tim or the team.
Absolutely. Yep. After this Instagram Live, there'll be a link in our feed that you can click on, and it'll get you in touch with one of our patient advocates. If you're already working with a current patient advocate, I'd ask you to stay with them and they can answer any questions. But if you're not a part of our BioX family yet, definitely click on our link to get more details. And then we're here to answer any of your questions. And we'll be doing more of these Instagram Lives, answering questions and that come through our feed. And I appreciate you guys' time.
Definitely. Thank you.
Thanks, guys.
Dustin, this has been inspiring. We appreciate your time and your efforts in trying to help all these patients that may or may not know that they can do things and don't have to take "you'll never do that again" for an answer. So we appreciate it on behalf of our patients. So thank you.
Yes.
Yeah, definitely.
Awesome.
Kick it right in the dick every day.
Thank you, Dustin.
Keeping it real with
Keeping
Dustin.
it real. That's why we're here.
Thanks,
That's
Dustin.
right.
Thanks, Jennifer.
Thank you. Take
All
care,
right.
guys.
Have a good one.